At the site of the former Royal Naval Hospital, the Bella Vista Dementia Day Centre opened its doors to service users this week. It'll see up to 90 dementia sufferers cared for during the day, providing welcome respite for their families. The opening served to highlight the limited space available for visiting vehicles. Getting there by public transport is also difficult, given the dangerous crossing. There are no nearby speed calming measures, no zebra crossings, pelican crossings or traffic lights.
Although it certainly has been the case that the government has not acted before, it is a new job for me. And I can tell you, Jonathan, that the Minister for Traffic, Mr. Balavan, has personally assured me that next week there will be a site visit with GHA professionals and the technical services and his department to see where and what measures can be put in place for a zebra or pelican crossing and road speed calming measures to make sure that it's safe for people to access or egress from the centre. But you're right, we haven't done it yet, but I'm going to personally make sure that it happens.
Thank you.
The Health Minister also committed to putting in place a specific transport solution for the day centre for those who couldn't drive themselves or catch a bus. The Viewpoint panel agreed dementia is having a very significant impact on our whole community. Families caring for a loved one suffering from the disease can feel very stressed, coming under economic and social pressure. The day centre is designed to alleviate this.
To come to the day centre and have specialised people who can essentially stimulate their minds and stimulate everything that goes with it and keep the mind working. The mind, although we think it's very complicated, it's relatively simple in terms of the more you use it, the better it is. So there is a point where we can reinforce simple tasks for people who are forgetting the simple tasks. So something as simple as a glitter ball or something as simple as lights stimulate certain areas of the brain, areas which are perhaps more prone to brain cell death, which is what we're essentially talking about.
With over 400 individuals diagnosed with dementia locally and the number growing every week, less than a quarter will be able to use the Dementia Day Centre. So what other care is on offer? The Gibraltar Alzheimer's and Dementia Society are concerned that Mount Alvernia, the primary care centre and St Bernard's Hospital are not dementia friendly. They argue that dementia care shouldn't be a lottery. Everybody, they say, deserves the same quality of care regardless of where you receive it. In response, Mr. Costa said recalibrating Mount Alvernia to better cater for dementia sufferers made absolute sense. The Health and Care Minister said he'd progress this idea with the Society and with elderly residential services. The Alzheimer's and Dementia Society also called for a dementia coordinator to make care more joined up. And they pressed for a system which red flags care users so that the moment someone diagnosed with dementia tries to access treatment at the primary care centre or the hospital, GHA staff know immediately that they're dealing with somebody who is suffering from dementia. And finally, a rather sombre thought. At the last count, there were 25 dementia patients locally in an unknown location, not interacting with the GHA, effectively dropping out of the community, despite their dire need for help. Dr. Rowell said, as a society, we need to get better at dealing with the challenges posed by dementia.
Suffering with dementia, who perhaps in a circumstance where they have fallen away from the standard